Good morning, good evening, good afternoon to whatever time you are watching me at. I am the braces doctor and I am here to teach you history of orthodontics. History of orthodontics is relatively little complex, so I have divided into two videos, one video for undergraduates and one video for postgraduates. This is a video for undergraduate students as they don't need much and they just need to understand the basic concepts of what are the history of orthodontics. Now, since the beginning of human history, humans have understood at a very basic level that if we can't chew well, we can't eat well. So a lot of inventors have contributed significantly to the fascinating science of orthodontics, and the one who has been given the greatest credit is Dr. Edward H. Angle. Will know and understand why he has been honored as the father of modern orthodontics. Now, orthodontics, as we all know, it has been at 1900s, it was called as regulation of the teeth. Till 1930s, it was known as orthodontia, which I had mentioned in my last video. In 1970s, it was called as orthodontics. Currently, it is known as orthodontics and dentofacial orthopedics. You can visit to any department if your college, and you can see that they don't just write orthodontics. It is orthodontics and dentofacial orthopedics, because we are not only dealing about the teeth, we are also dealing with the dentofacial skeleton, like as we have already learnt about the skeletons, that is maxilla, mandible, zygomatic. So here we are much or less we are learning about all the skeletal systems. Next come ancient civilization. So history has been very interwoven among each other for 2000 years. So in dentistry has its parts. So the first one was Greek physicist Hippocrates, who was the first one to separate medicine from fancy or religion. As we all know, in India, in the previous time, they used to go to tantrics, or they used to go to in foreign countries, they used to go to the fathers for correction of anything in their body. They used to feel that there is a curse from the god, so they can be treated. But it was actually Hippocrates who told that no, it is a very much science to it, it is not much of a religion. So Hippocrates was the one who collected all the information on the basic facts. He wrote a book, okay, and it was known as Corpus Hippocraticum. Later, Aristotle came, and he was a Greek philosopher. So understand this, they all are not doctors, they were just philosophers, they just collected facts, okay. Now it came Aristotle, who was a Greek philosopher, and he was the first writer who wrote in a very broad manner, and he wrote as, his text was known as De Partibus Animalium, which is known as on the parts of animals, because we are also a part of animals, we obviously don't belong to plants, right? So he wrote as De Partibus Animalius. Next came Aulus Cornelius Celsus. Now this name is very much important, you should know what he did, okay. He was the first one who described that with finger pressure people can move their teeth, move the teeth, okay. When in a child a permanent teeth appears before the fall of a milk tooth, it is important and it is necessary to dissect the gum all around it and extract it. The other tooth must be pushed by the finger day by day. Have you seen that grandmoms and moms, they used to tell us that use finger pressure, move the teeth which is about to be extracted, okay. Continuous movement of that tooth helps in resorption of the root. What happens is, there is a tooth, this is the gums, think this is a primary tooth, okay. Now below it there is a crypt of permanent dentition. When it starts moving, this thing will get resorbed. The root is getting resorbed. We are applying pressure over here to continuously move it so that it gets detached from the gums. This is about extraction. Same thing when a tooth is erupting. Okay, the tooth is erupting, we will continuously give some pressure. If we feel that the tooth is more backwardly placed or lingually placed or labially placed, we apply some pressure and it will correct it. Okay, so this is all about ancient civilization. Then came the Middle Age through 17th century. This is in the reference to dentition during this period. What happened was, there was divided into Renaissance period, 14th to 16th century, and of course the 18th century. Renaissance period. What do we get from this? We already know it is during the Renaissance, one of the greatest geniuses of the history was there. That was Leonardo da Vinci. Okay, he is remembered because he painted a smile on the lips of Mona Lisa. Her smile remains most provocative, yet the brush was the only one of the many tools he mastered. He was the first artist to dissect human body for acquisition of anatomic knowledge and the first to draw accurate pictures of those dissections. He was the first one to recognize tooth and realize that each tooth was related to another and to the opposing jaw as well, thus perceiving the articulation of the teeth. He understood maxilla, frontal sinus. So basically what he did was he dissected the human body. Okay, and he saw what is the relation of each position to each other. So the greatest one, Leonardo da Vinci. Okay, so so as you have seen, the picture of Mona Lisa is one of the most beautiful pictures because it is symmetrical. He has greatly captured the essence of a human face. Next came Andreas Vesalius. He was also a physicist and anatomist, and he dissected, and his work was on the fabric of human body. He described anatomy of the teeth. Second was Andreas Vesalius. You just remember Leonardo da Vinci, that is enough for you people as undergraduates. Okay, so next came Bartholomew's statue and a lot of people who understood that once the teeth falls down, the permanent dentition comes into place. Next came 18th century. 18th century witnessed major events in the development of dental science and dentistry, and during that time the leader was France. Okay, so now this picture which you are seeing is known as bandelette. And it was given by Pierre Fauchard. Okay, Pierre Fauchard, he gave bandelette. It was the first, probably it is the first orthodontic appliance which was designed to expand the arch, and it is forerunner of the expansion arch. Now what happened was, you see these holes are there, tooth will be in between this. If there is crowding, we understood crowding in the last lecture. Okay, so if there is crowding, this strings which is just around the teeth will be tightened from this end. so that this teeth will move forward and it will follow this shape. Understood? See here, there will be molar here, a molar here, premolars, canines, lateral incisor, central incisors. Okay, if there is any crowding, then these strings will be wrapped around it and it will be tightened so that it follows this pattern as we see in normal teeth. Think how advanced it was in the era of 18th century. Okay, so this is a bandelet. Next came 19th century. 19th century foundations were laid in 19th century for the oldest specialty, that is orthodontics. In 19th century, basic concept of diagnosis and treatment has begun. By this time, each practitioner attempted treatment to devise their own method based on mechanical principles. Okay. At this time, orthodontics was a part of prosthodontics actually, and later on, it was in later century it was divided from prosthodontics. So what happened was, by 17th and 18th century, people understood that if teeth are not in the correct position, they are not looking nice, they are not able to eat properly, they are not able to chew properly. So they wanted to prepare some appliances in which they can adapt well. Okay, now next came such as bandelets, in which they used strings and those bands to correct the tooth. In 19th century, bandelet was a kind of expansion, right? We learned about that in the last lecture, right? If there is an elevator for 4 people and if there is a 6 people, what are the options? First was either we have to keep 2 people outside out of 6 people. Next, either we have to make the 6 people little thinner so that they can adjust into the elevator, and third option was either I have to expand the elevator a little bit so that it can accommodate 6 people. So this bandelet was a concept of increasing the size of the elevator. Okay, so then it came expansion appliance by Emerson C. Angel. See, this angel and angle, they are different. Okay, don't confuse in between that. First was J.S. Gunnell, who told that chin strap, this occipital anchorage, we can use it to provide treatment for mandibular protrusion. This is the opposite picture, in that from this occipital area strings will be attached and there will be a chin cup over here, so that if the mandible is moving forward, it will stop it. Okay, so in 19th century they prepared this appliance, so by J.S. Gunnell. Next, Emerson C. Angel, he said that we have to expand, this is a mid-palatal suture, we have to expand this whole arch to accommodate people, right? Same as the elevator concept. So this was given by Emerson J. Angel. Next came Magill. M for Magill, M for molar bands. So he introduced the concept of molar banding. Till then, you see, there has been no proper banding. Banding means covering, encapsulating the whole tooth. Okay, when you are covering the whole tooth from labial surface to the palatal surface, that is called banding. In these sections, you can see it is only in the palatal side. It is not covering the whole teeth. But Magill said, I will cover the whole teeth by a molar band. So William and Magill, they developed molar band, and that too in 1871, kind of 19th century. Next came John Nutting Farrar. He published a book which told about irregularities of the teeth and their corrections. Okay, the textbook was for brace appliances, and he was the first one to suggest that use of mild force to move the teeth. Okay, next came Norman Kingsley. Norman N. Kingsley. He introduced this appliance. This is known as jumping the white. He used vulcanite. Vulcanite is a kind of gummy material. Okay, with the help of elastics, bands, whatever he had, he developed this technique of jumping the bite for correction of any kind of protrusion or retrusion. He also started off with correction of cleft palate in those times. Okay, next came Henry A. Baker. Okay, Baker's anchorage. Henry A. Baker is a very important question. It will come as 5 marks, 2 marks, and what is that? Okay, so Baker's anchorage is the use of intermaxillary elastics from upper canine to lower molars for in class 2 cases, and upper molar to lower canine in class 3 cases. Okay, what is this Baker's anchorage? Actually, you will learn in the chapter of anchorage. Okay, for now just remember in class 2 what happens in class 2. Class 2 means when your maxilla is moving forward and your mandible is at the correct position. Class 3 for you people. Okay, there is a great things about class 2 and class 3 which we will eventually learn. As of now, just remember class 2 is when maxilla is forwardly placed and class 3 is when mandible is forwardly placed. Correct? Next came th century. In 20th century, it was more for dynamic things, influential things. Okay, so first it was the greatest of all, the real OG, Edward Hartley Angle. Okay, he has a lot of history. You don't need to learn much about that. Okay, you just need to remember that what Edward H. Angle is. There are some points. He is the, of course, father of orthodontics. He gave classification of malocclusion. He gave E-arch appliance. He gave pin and tube appliance. He gave edgewise technique. Just remember, he is the Mogambo of orthodontics. Okay, during that time no one had a chance to speak in front of him. No one can say anything against orthodontics in front of him. So he was the Mogambo. Okay, so what he did was father of orthodontics. Classification of malocclusion. Malocclusion classification we'll learn in the later classes. Just remember, it was actually Edward H. Angle who gave those malocclusion, and it is a very simple one. Next, he gave E-arch appliance. E, of course, according to his name. E for Edward, E for E-arch appliance. Next, he gave pen and tube appliance, and as for E, edgewise technique. So don't confuse between E-arch and edgewise. It is totally two different. It is an appliance. E-arch appliance is an appliance. This is a technique. Appliance can be used inside a technique. Okay, so this was all about Edward H. Angle. Next was the famous Calvin S. case. Calvin S. case was the one he had some guts to stand in front of Edward H. Angle. Okay, and he had the courage in himself to fight against Edward H. Angle. So what actually happened was, this is a very great story. Edward H. Angle used to say that if God has given us the teeth, God has given us the arch, so it is that much that all the teeth can be accommodated inside it. No need to extract a teeth. Every time we can expand the elevator and we can put. Okay, but Calvin S. case, he was the first one. He advocated extractions. He advocated extraction. He told that no, it is not possible. Every time we cannot expand the elevator, we cannot expand the arch. Sometimes we have to remove two people from the elevator for the elevator to fit in. Okay, and he was the first one to use elastics. He was the first one to use light wear. He told not a very heavy force is not mandatory to move the teeth. Even a smallest, lightest pressure can move the teeth. And he had a great contribution for prosthetic repair in cleft patients. Okay. So this is all about Calvin S. case. He is also a pioneer in orthodontic mechanotherapy. He was the first one. He told that not only the tooth crown but the root has to be moved for the correction of it. Next came Charles A. Hawley. A lot of people must have heard of Hawley's appliance. Okay, this appliance was actually made by Charles A. Hawley, and he told that with this you can either move the teeth or you can, after the treatment, you can use it as a retainer. Okay, next came B. Hawley Broadbent. He was the first one. He published an article on X-ray technique in orthodontics. Okay. He told that we can prepare an instrument which can accurately position the head relative to the film. Okay. So this was, and lastly it was Kesling. A great pioneer, a great person who could visualize orthodontics after 100 years. Okay, so what H.D. Kesling was, he told that his philosophy was we can move the tooth by using rubbers and we can prepare. So he gave one tooth positioning appliance, which is the concept behind aligners. Today you have seen lot of advertisements of this toothsy aligners, illusion aligners. That's a very transparent material, but that concept actually came from H.D. Kesling, who proposed this tooth positioning appliance. Okay, so this is all about a basic thing about history of orthodontics. There, for the postgraduate students, we can divide the history of orthodontics into history of orthodontics in United States of America, in Greece, and in Great Britain, because there were some situations where people were more concerned about extractions and tooth correction, and there was some concept between going on that tooth correction is not that important, we have to correct the skeleton first. So the basic details about it, I'll post a new video on that, describing. It will be a much elaborated one. This is just a basic concept for undergraduate students. So those who are new to my channel, the last video was introduction to orthodontics. You can go and visit, and the next video will be growth and development. Although I have put some videos on growth and development, but I'll try to do it again. so that this will be in a flow for the undergraduate students. So if you like my channel, do like, subscribe and comment if you want any videos, or you couldn't understand any concept from history of orthodontics. I'll be happy to help you, and I'll be happy to tell you what are the details, and I'll be happy to comment you and message you what is the actual concept behind it. Thank you everyone. Goodbye.